So this next section talks about blood type. A person's blood type depends on what carbohydrates are on the surface of red blood cells. So if we think about what the major types of blood are, we have blood type A, type B, AB, and O. On our red blood cells, we have antigens. Antigens I like to call the cell ID card, or the cell identification molecule. So it's something on the surface of the cell that gives that cell its identity. If we have the A antigen on the surface of our red blood cells, we have blood type A. If we have the B antigen on the surface of our red blood cells, we have blood type B. If we have both A and B antigens on the surface of our red blood cells, then we have blood type AB. And if we have neither A nor B antigens on the surface, then we have blood type O. So, a patient that has blood type A automatically at birth produces B antibodies. So what that means is that if you have blood type A, you have that A antigen on the surface of your red blood cells. You never want to see the B antigen. So at birth, you produce B antibodies. Antibodies want to kill whatever they're against. So they produce B antibodies to kill the B antigen, or to target and destroy the B antigen. So if you have a patient that has blood type A and you give them a blood transfusion with type B blood, these B antibodies are waiting in the serum of this patient. So the incoming B blood will be attacked by this patient's antibodies. Blood type B is the same way. Blood type B at birth hates A. B never wants to see A. So B produces A antibodies. Blood type AB doesn't produce the A or the B antibody. Blood type O is used to not seeing any antigens on the surface of its red blood cells. So if you have blood type O, you're going to produce both the A and B antibodies. So if we talk about who can donate to who, and who can receive from. Everyone can donate and receive to their own type. So blood type A can donate to A, blood type B can donate to B, blood type AB can donate to AB, blood type O can donate to O. Blood type A can receive from A, B can receive from B, AB can receive from AB, and O can receive from O. Blood type A, so who else can they donate to? A cannot give to B, because if we look at this chart, B hates A. B has A antibodies that are ready to kill the A antigen or attack the A antigen. Can A donate to AB? Well, AB doesn't produce antibodies against the A nor the B. So yes, it can safely donate to AB. Can A donate to O? Well, blood type O produces the A antibody, so no, that would not be safe. So the only patients that a blood type A could be given to would be A or AB. Blood type B is similar. B cannot be given to an A patient, B can be given to an AB patient, and B cannot be given to an O patient. Blood type AB. We can't give blood type AB to an A patient because the B component would be attacked. We can't give blood type AB to a B person because the A component would be attacked. And we can't give blood type AB to an O patient because both the A and the B would be attacked. So AB cannot give to anyone except for AB. Blood type O. Blood type O, if you look at it, doesn't have anything on its surface to attack. So blood type O can donate to everybody because nobody can attack anything on the surface of O. There's nothing there to attack. O is our universal donor. Now, blood type A can receive from A, and who else can they receive from? Well, blood type A hates B, so they couldn't receive from B, they couldn't receive from AB, but they can receive from O, because there's nothing on the surface of O to attack. So blood type A can receive from A and O. For the same reason, blood type B can receive from B and O. There's nothing on the surface for it to attack. Blood type AB can receive from everyone because AB doesn't produce antibodies that are designed to attack and kill the A or B antigens. So they can receive from AB, A, B, and O. These are considered universal recipients. Blood type O can only receive from O. They produce both the A and B antibodies, so any other blood type would not be acceptable. So what about this Rh factor? I'm sure you've heard if somebody tells you their blood type, it's usually like A positive or O negative. The Rh factor has to do with the positives or the negatives of the blood type. If you have the Rh factor, that means that you are positive. If you don't, that means you're negative. And all that is just an extra protein that's on the surface. So you've got your red blood cell, you've got your normal A or B antigen, and then you have this extra factor that's on the surface of the red blood cell. And if it's there, you're considered A positive or B positive or AB positive or O positive. And if you don't have it, then you're considered negative. Normally, if you don't have it, you're not automatically going to produce antibodies against it at birth. You have to be exposed to it in order to produce antibodies against it. So, first exposure can happen during a blood transfusion or during pregnancy with a positive baby. So this is when it becomes an issue. If mom is Rh negative and the baby has Rh positive blood, the first pregnancy, about halfway through gestation, when the baby starts producing their own red blood cells, the mom is going to start to develop antibodies against the baby's red blood cells. And during the first pregnancy, it's usually okay. But the second pregnancy, if an Rh negative mother is pregnant with a second Rh positive child, now the antibodies are going to exist. And as soon as that baby starts producing their own red blood cells, which again happens about halfway through gestation, the mother's antibodies are going to attack and kill the baby's blood, essentially killing the baby. And a former student of mine, actually, this happened to. She was never tested. Her blood type was never tested. And she had a couple children, and during her second pregnancy, she ended up losing the baby, and it was due to the Rh factor. She was an Rh negative mom, and she had to give birth to a stillborn baby that was Rh positive. So it was a terrible tragedy, and I don't know how that even happened, especially with how medical records are today, but it was something that happened to her. So we call that erythroblastosis fetalis. And again, that's when an Rh negative mom is pregnant with an Rh positive baby. The mom's antibodies will attack the baby's blood. It wouldn't happen the other way around, because baby doesn't have a fully functional immune system until 1 year after they're born. So they would never be able to produce enough antibodies in utero or even have an immune system while they're inside of the mother to be able to attack the mother. But it does happen from mom to baby, where the baby would be lost. And again, that's erythroblastosis fetalis. So whether it's the first, second, or 27th pregnancy, they give mothers that are Rh negative these RhoGAM shots. And the RhoGAM shots prevent the mother from developing the Rh antibody so that the baby is safe during the pregnancy.